The BioAfrica Convention will be held as of tomorrow with the World Health Organization to discuss how the continent is responding to COVID-19. The main objective of the convention is to stimulate African biotechnology businesses for the benefit of the continent. Mmboneni Muofhe is the Deputy Director General of the Department of Science and Technology. A very good evening to you and thank you so much for joining us. What can we expect from the BioAfrica Convention 2020, especially in relation, as I mentioned, to the pandemic?
Good evening, Sepiso, and to all the viewers of SABC. What I think we need to expect from the BioAfrica Convention this year is that we obviously have to respond to COVID-19, a challenge that we didn't have to deal with last year. So what we're trying to do now is to bring together all the startups that are in the biospace so that we can put them together in the digital space so that they can share what kind of new innovation they have that can actually help us deal with the pandemic.
So if we're talking about, you'd imagine a lot of people wouldn't really understand how biotechnology could help in such a case. So if you could just take us through some of the innovations. I know the World Health Organization addressed you last year, and that was pre-COVID. So what would then be the material differences now amidst COVID?
So the main differences is that when you look at the role of biotechnology in health, so basically where we are in terms of vaccine development, in terms of development of various treatments because of biotechnology. So our focus this year will therefore be on how do we step up. So we might have had yesterday the minister talking about the challenges around testing and some of the testing kits and the reagents that go into testing. This is what some of the companies that are local can actually step in and manufacture. So by creating that marketplace, you are able to say, look, this is this company that is based in this place. They can actually do X, Y, and Z. So by doing so, you are able to bring them together with the funders, with the financiers, and then you can also see various health departments, even in the continent, really coming on board and saying, let us start to buy local. Some of them aren't aware of the level of innovation that is happening in this continent.
So what is the level of innovation, bar what we know is the immediate needs, the PPEs, for instance? We know what is needed in hospitals. What would XYZ be in your example of what companies can provide?
So we're looking at the diagnostic kits. We know that diagnostics is quite a very critical area. We are looking at a number of reagents. So a diagnostic kit will with it go with a number of other chemicals that we can actually, and enzymes and proteins that we manufacture locally. So those are some of the things. Now the aspect of PPEs as well, really the technologies differ. So you have some of the products that you might have had even internationally, even if you're talking around testing, that have actually been recalled because of the quality. So you might be having a lot of testing kits and medication that is coming on board. But one of the things that you need to focus on, of course, is to what extent do you have products that are of much better quality, perhaps compared to what we have currently in the market.
Okay. Just a final one. I know you're saying that you would also ensure that you have a trusted portal of information, of accurate information around COVID-19. What would be the marketplace innovations in that area?
So in terms of creating a market that will be trusted, one of the things that you need to know right now is the information that is in the public. We've got some very good information. I think nationally we've been able to communicate very well, but we have also had a lot of misinformation. So the packaging will also include how do we communicate with the community so that they can understand what this pandemic is about and how to actually keep themselves safe.
Okay.
And secondly,
Mr. Muofhe, oh, okay, thank you very much. I thought you were going to complete your sentence there, but thank you so much. Mmboneni Muofhe is the Deputy Director General of the Science and Technology Department.